Hi, I'm Sarah Nasto. I'm an OTA student. This is my skills check for transferring for bed mobility and then stand to sit pivot transfer. The purpose of this video is to educate caregivers and patients' families on safe transfers according to the assignment. The purpose of each transfer, so the purpose of bed mobility would be to maybe sit a patient up. That my patient here is in a supine position, so it would be to get her to sitting, to prepare her to get up and use the toilet, to get up and feed herself, to go to a group therapy session, or to perhaps ambulate around the clinic if that's part of her treatment plan. To sit in a chair, of course, that's pretty self-explanatory. They want to eat in the chair. They might be sitting to do some grooming or some bathing in the bathroom. So it's important for them to know safe transfers, to be able to transfer their family member should they need those services. So the first thing I'm going to start with is I'm going to start with the supine to sit position, and then my camera person is going to change their angle to come over here so you can see the work from sitting to standing pivot and then sitting again in the chair. Hi, how are you today?
Good.
My name is Sarah. I'm going to be your OTA. They let me know that you'd like to sit up and get dressed.
Yes.
So I'm going to help you sit up. I know that you are moderate to max assist, which means my patient is going to do less than 50% of the work for me. So I have to make sure I maintain safe body mechanics and that their positioning is safe if they have any precautions for ostomy bags or any kind of hip precautions from surgeries, etc. So what we're going to do is, if you're okay, we're going to, I'm going to roll you towards me, and then I'm going to pull your legs around towards my body, and we're going to sit your trunk up, okay? How are you feeling today? You feeling okay?
Yeah.
Do you have any pain anywhere?
No.
Okay. Are you okay if I take this blanket off of you?
Yes.
Okay, I'm going to raise your arm, and I'm just going to fold this blanket back. If we were in a shared room, this is a time when I would pull the privacy curtain to give the patient safety and privacy during this transfer. Okay, so your name is Mackenzie? Okay, so Mackenzie, we're going to roll you toward me onto your side. Can you do any rolling by yourself or no? You're unable to?
No.
Okay, so you do what you can, and I'm going to do the rest, okay? So just want you to, we're going to swing you this way. Ready? 1, 2, 3, roll to your side. Good. Are you comfortable like that?
Yes.
Okay, you feel safe?
Mm-hmm.
Okay. So at this point, I just want to make sure I keep checking in with my client to make sure that there's no pain anywhere, to make sure that any wires or apparatus are positioned the way they should be, and that she's feeling comfortable and ready to move forward. Are you ready to move forward with the rest of the transfer? Okay. So I'm just going to take behind your legs, behind your knees. I'm going to swing them down, and then we're going to sit your torso up. Okay, so I'm just going to hold you under here. Is that comfortable for you?
Yes.
Okay, so on 3, we're going to swing this, and I'm maintaining proper body mechanics. So we're going to go 1, 2, 3, and I'm going to swing your legs over. You doing okay?
Yes.
And we're going to sit you up. Ready? 1, 2, 3. Come on up. Okay, we're going to sit here for a second. Sometimes patients who have been laying down for a long time may get dizzy. If there's some hypotension there, so we want to give her a second to also just orient her body in space if she's been laying down for a while. How are your feet?
Good.
I'm just going to fix your feet for you, okay?
Okay.
There we go. Do you have any pain anywhere?
No.
Okay. So I'm going to put this gait belt on you. This is going to keep us safe. Are you okay sitting by yourself? Yeah, you have trunk control? Okay. So I'm going to put this around you, and this is going to keep you safe so that we can move you to where you need to be. So you can go have some breakfast, and you can go get dressed, and maybe go play some games in the clinic today, okay? All right, so when I put the gait belt on, I want to ask the patient if they've had any surgeries recently. Do you have any ostomy bags or any holes or tubes you need to be aware of? Okay, there's nothing obstructing her abdomen at this time. She doesn't have any pain or any skin breakdown. When I put the gait belt on, I want to make sure that it is pulled nice and snug so that she doesn't slip out. My volunteer is a very tiny person. So when I'm doing this, I should be able to slide my finger in here, but I shouldn't have any more space than that because we don't want them falling out of the gait belt. So I'm going to make sure that all the slack is tucked in. Again, maintaining those safety precautions and minimizing any fall risks. Before I pick my patient up, I'm going to check in with her again. Mackenzie, how are you feeling? You've been sitting for a while. You feel like you're ready to stand?
Yes.
Okay, so what we're going to do is I'm going to hold you by the gait belt, and I'm going to have you put your hands around my waist. We're going to rock.
Okay.
We're going to rock to me, 1, then we're going to rock back 2, and on 3, I'm going to have you stand up as best you can. We're going to stand, and we're going to pivot. We're going to turn our bodies, and my foot's going to be here. My foot is blocking. This patient is less than 50% able to assist, so I want to make sure that I'm keeping a secure base there. So if her feet were to fall out from under her for a patient who doesn't have the use of their trunk, I want to make sure that I am their trunk for them. So my foot is here to keep her feet from sliding out. Up, and you're gonna stand here just for a moment, and once you feel the chair on the back of your knees here, if you can, I'm gonna sit you down, okay? I'm gonna check in with you throughout the process. If at any point you feel unsafe or shaky, let me know, and we'll pause, okay? Great. All right, so I'm gonna come in here. Again, remember, I want you to put your hands on my waist. You comfortable with that? I always wanna check in with the patient to make sure I'm maintaining that they're comfortable and that they consent to the movements that we're doing. Okay, so I'm going to reach under here, and I'm going to hold you by the gait belt. Okay, is that comfortable for you? There we go. Okay, so again, I'm down here protecting her. We're going to rock towards me. 1, 2, 3. We're going to stand up. Good. And we're going to pivot. You comfortable? And we're going to sit. Sit. Okay. Put your hands here for you. How are you? Can you feel the chair on the back of your legs?
Yeah.
Okay. Are you comfortable like that? Okay, here's your drink. So, to follow up, as a caregiver of a patient who would need these services, you can follow up with the occupational therapist that's working with your family member, or you can certainly follow up with the OTA. I'd be happy to walk you through those steps again if you have any questions, okay? Thank you, Mackenzie. Thank you.